Okay, this question is gonna trigger so many people.
Say, oh doctor, I'm having fruit juice in the morning, orange juice in the morning, and then I have another glass of juice or smoothie with lots of fruits in the evening. In the last 50 years, we have been fooling our brain. Invisible sugar is nearly in everything you eat. You think it is healthy, but you're eating 30 grams of sugar. The food industry is trying to sell you sugar-free products, but it has to be edible also. People think yogurt is healthy, but you have flavored yogurts, you're consuming more sugar. Say, oh, my 𝒔𝒊𝒐𝒏 is normal, I don't have diabetes. No, you don't know the very next day, you may develop prediabetes. In a month, you may develop type 2 diabetes. Have you been told that you got diabetes? Or have you been told that you got pre-diabetes? Have you been given a diagnosis by your doctor about whether you got diabetes or pre-diabetes? Well, that's the biggest worry now. It may be wrong and you may be unnecessarily worried, or you may be unnecessarily extremely careful about your medical condition. So that's the biggest myth which needs to be busted. The first point is, people do not follow books. The business about range is all made up, it's man-made. For example, an 𝒔𝒊𝒐𝒏 of 6.5% or more is diabetes, 5.7% or more is pre-diabetes, is just made up. The human body doesn't follow books. It's a continuum. So there's a continuous process. For example, if people with diabetes are known to have a higher incidence of heart attack or stroke, it may be that even at a lower blood sugar level, even at a pre-diabetes level, the risk of heart attack or stroke may be exactly the same as diabetes. But your doctor may not be giving you the right advice, and that's the critical bit. For you to understand that it's a continuum, so you need to be careful. For example, if your 𝒔𝒊𝒐𝒏 is 5.5%, which actually is normal, because 5.7 and above is pre-diabetes. So you can't be complacent, you can't be casual and say, oh, my 𝒔𝒊𝒐𝒏 is normal, I don't have diabetes. No, you don't know the very next day, you may develop pre-diabetes. In a month, you may develop type 2 diabetes. So the point to remember is, you need to be careful all along and do not follow the range which has been given to you by your doctor.
So people often confuse hunger and false hunger. What can they do for that, sir?
Okay, so this is very important, I feel. In weight management, I always advise my patients to drink at least 3 liters of water a day. The reason is, our brain is getting confused these days. So when our brain sends a signal for hunger, actually it could be thirst. In the last 50 years, we have been fooling our brain. So when we feel thirsty, what we do? We don't go and drink water. A lot of us go and drink juice or fizzy drinks, Coke, or some sugary water, flavored water. So the brain is thinking, okay, I asked for water, but you gave me water and calories. So a lot of people, the sensation of thirst is blunted. So if you're in a weight management plan, or even if you've got diabetes, it's always important to keep yourself well hydrated, because the sensations may not be coming correctly from your brain. I usually advise 3 liters of water, but it's a big but. Those who have kidney failure, liver failure, or heart failure, you should consult your doctor about the amount of fluid you can take. So water intake and hydration is very important. It's also very important if you're on these newer medications like 𝒊𝒏𝒈, Wegovy, Udapa, Mounjaro. It's very important to keep yourself well hydrated.
Okay, tell me this one, sir. Fruit or fruit juice, which spikes sugar more?
Very good. I think you asked a very pertinent question. A lot of my patients come and say, oh doctor, I'm having fruit juice in the morning, orange juice in the morning, and then I have another glass of juice or smoothie with lots of fruits in the evening. That's the worst food habit you can have, especially if you have diabetes. The reason is, if you have fruit juice, the absorption of sugar is very rapid. So you have a rapid spike in your blood sugars, which is not good. Every time there's a rapid spike in your blood sugar, your pancreas gets damaged. The beta cells in the pancreas gets damaged. But if you have a whole fruit, it contains fiber, other nutrients, and the sugar absorption is also slow. So for example, a glass of orange juice may contain up to 3 oranges or even sometimes 4 oranges. But can you eat 4 oranges in 2 minutes? But you can finish a glass of orange juice in 1 minute or even 30 seconds. That's the reason it causes rapid spike in blood sugar. So my advice is go for fruits rather than fruit juice.
So, people who come to me always say they skip meals for some reason. So, skipping meals, does it really spike the sugar levels, sir?
So a lot of my patients with diabetes, they think that let me skip a meal, or some are more interested in intermittent fasting. That's all good. But the thing is, it should be personalized to yourself. So I'll just give you an example. One of my patients skipped his meal, blood sugar dropped, and then in a subsequent meal he was very hungry. So what he did was, he started with some chocolates because his blood sugar dropped so low, and suddenly there was a spike. And then if you skip a meal for a longer duration, and if you're hungry and you're fasting, your cortisol levels can go. So it is a complex process, and it depends from person to person, how it's going to affect your blood sugars, how it's going to affect your hormones. So as an endocrinologist, I can't give you a straight answer. I think the best thing would be to get in touch with us if someone is planning to skip meals, or if there's rapid spikes in blood sugar, and we can help you.
Do you know how much invisible sugar that is present in ketchup, energy bars, these flavored yogurts, sir?
Okay, I think it's a very good question. We all get fooled. Invisible sugar is nearly in everything we eat. Most of the stuff we eat has got invisible sugars. For example, the ones you mentioned, like ketchup, bread, healthy bars and flavored yogurt, they all contain sugar. I'll give you some examples. 1 tablespoon of ketchup contains 1 teaspoon of sugar. So every time you take a tablespoon of ketchup, don't think it's just tomatoes. It is 1 teaspoon of sugar. Similarly, if you have a slice of bread, it's again contains sugar. And the worst bit is these healthy bars. It's not healthy anymore, because it can contain up to 20 grams, some contain even 30 grams of sugar. So that's quite serious. You think it is healthy, but you're eating 30 grams of sugar. And the same thing is with bread, which I mentioned, and also yogurts. People think yogurt is healthy, but if you have flavored yogurts, you're consuming more sugar. So please be aware of what we call healthy. There is hidden sugars in all these products.
So, sir, if a food that is labeled sugar-free, is it really safe for people with diabetes to consume it?
So, any product which says sugar-free doesn't mean it's sugar-free. There's at least 0.5 grams of sugar per serving. And it doesn't mean that there's no carbohydrates or any other products. So, most products which they say or claim to be sugar-free can have other carbohydrates, starches, sugar alcohol like sorbitol, and all these can also increase your blood sugars. So a product which says sugar-free is not, you can't say it's safe for people with diabetes. So what you need to understand is the food industry is trying to sell you sugar-free products, but it has to be edible also. It has to be tasty. So they'll add something extra to make it more tasty. So don't get fooled, always read the label. Even though it says sugar 0.5 grams, which is sugar-free, look out for carbohydrates, starches, sugar alcohol, artificial sweeteners. It's very important for people with diabetes to look out for that.
Okay, this question is going to trigger so many people, but can people with diabetes really have rice?
So it's a very good question. People with diabetes can have white rice, but the portion has to be very controlled. So that's the most important thing to remember. More you deprive yourself of certain things, more you want it. So that's completely avoiding white rice is not a good idea. You can have white rice, but it should be in a smaller portion. And the most important thing, like you advise as a specialist dietitian, I remember you telling our patients that it should be mixed with vegetables, legumes, or low glycemic index food, so that the absorption of sugar is slowed down. So when you have just white rice in bulk, you'll find that the sugar spikes very rapidly. What you don't want is the rapid spike in people with diabetes. You want a slow rise of sugar. So for that, I remember you saying that you should add vegetables, or even start with the vegetables, or have some other legumes, so that it slows down the absorption of sugar. So the answer to the question is yes, you can have, but it should be in moderation combined with vegetables and legumes.